Hi everyone, welcome back. Dr. Angela here with you.
Hi, I'm Dr. Patty.
So in this video, we're going to continue our series on thyroid health. We're going to focus on Graves' disease in this video. So Graves is hyperthyroidism, so too much thyroid hormone, but it actually is an autoimmune process. So the reason this happens is that the immune system is confused. And so as Dr. Patty and I always talk about, we're going to talk about, treating the elevated thyroid hormone, but we also have to deal with the immune system confusion, getting to the underlying reason that something has happened. So first of all, how do you know that you have Graves' disease? Well, usually you're feeling pretty uncomfortable. Graves can be a really intense situation. When we make too much thyroid hormone, we can get symptoms like racing heart, so palpitations where you hear your heart beating in the middle of the night. Anxiety, rapid weight loss, feeling just too hot or agitated, like you're just snapping at everybody. When cases are a little bit further along, sometimes people get the kind of bulging eyes that some of us classically think about with Graves' disease. And so none of these are pleasant symptoms, and also this can be a life-threatening situation if not dealt with. And so the treatments in conventional medicine tend to be rather intensive treatments because it is a very severe, serious condition. And so the typical options for treatment, well, first of all, so just working it up. So blood tests. So typically you have these symptoms and then there's some blood tests. Definitely we're going to check the thyroid levels as usual. So T3 and T4 and TSH as usual, but then also TSI antibody is typically done to diagnose Graves' disease, to differentiate it from some of the others. So getting back to treatment, so usually there's three different routes of treatment in the conventional medical model. So sometimes medications are tried to just slow down the impact of the excess thyroid hormone to kind of dampen that effect. If that's not working, then sometimes the thyroid is shut down permanently with a radioactive iodine dye that's meant to essentially take out the thyroid gland function but without surgery. And then also sometimes a total thyroidectomy where the thyroid is taken out. So it depends on what's happening for you. Your medical team will make that evaluation.
And then sometimes other adjunctive pharmaceuticals to
Yes.
manage some of these symptoms that you're having. Insomnia, anxiety,
The racing heart.
So it may be anything from a sleep aid to
beta blocker.
a beta blocker. So there may be a whole slew of medications that a patient is put on just to kind of help manage everything. But luckily, there's naturopathic medicine that can sort of look at the bigger picture. So anyways, as you were saying.
No, definitely. So, the good news is there are very effective treatments that we can use, and we're going to talk to you about those, so there is hope. And that this is a situation where you want to do this under the care of someone because things can very quickly turn if things are not, managed well. So, what are some things that we like to do to kind of calm down thyroid?
So just to kind of reiterate, it's sort of from the naturopathic side of things, it's a bit of a two-pronged approach. So we want to, I always say with patients, it's a little bit of a dance because we do want to make patients feel better. We want to feel better and manage some of the symptoms and things that are happening, but we also at the same time want to be looking at and working on the underlying cause.
Definitely.
You're going to hear the phrase underlying cause like a million times.
We got very
videos.
sick of it in our training.
But it's true. Things don't just happen for no reason. So as far as the act of actually treating the thyroid and the symptoms that are kind of coming up from it being overactive. Some of the herbs that we love. Lemon balm is one. So also very good at kind of calming the nervous system. It's very gentle. It can help with sleep. It can help with anxiety. What's another one that you really like?
Bugleweed is another one that's very commonly either in formula or given single dose, depends on what's happening. But Bugleweed's very common.
And as you mentioned, for Graves, it's very common to have that heart racing and palpitations and tachycardia. So palpitations meaning you can kind of feel your heart rate, but tachycardia meaning that it's going fast. And Motherwort, also known as Leonoris, is a great herb for addressing the heart. And Leonoris is sort of thought as the sort of like a mother's hug is how they describe Motherwort. So it's for the heart, for the emotional heart, as well as the physical heart, and really good at calming down that heart racing.
Yeah, definitely. Passion flower, kind of along those lines too, of just herbs that are very good at calming down the nervous system. You had mentioned when we were chatting earlier, even using the amino acid theanine for that kind of same reason, and that's a good. I
love theanine. So excellent for just really balancing and calming without like
sedating.
Like, you know, a lot of medications or even some stronger herbs can kind of like do this, where it kind of comes in and like takes over. But this is a way to work with your body to really just kind of bring some balance and calm, because in Graves everything is really amped up and working quickly.
So all of those that we just mentioned are really to kind of counter the effect of the excess thyroid hormone being produced and all the peripheral effects that thyroid hormone has. But then we're also going to do work to get to the underlying reason the grave is occurring and work on calming down the immune system. So to calm down the immune system, you know, we do several things repeatedly. One of the things we do quite often to calm down the immune system is use things like essential fatty acids, vitamin A, vitamin D. Those are all really good helpers at calming the immune system. But then the gut too. We often go to gut healing and talking to the immune system.
Often when there's an autoimmune component or there's an autoimmune disease, we want to treat the gut, because this is where the majority of our immune system lies, and a healthy gut will optimize our immune system. So those nutrients that Dr. Angela mentioned, you know, the beauty of nutraceuticals, herbs, supplements, they don't just do one thing. It's not like a drug that maybe was designed to focus on one biochemical pathway. So even like the vitamin A, for instance, it isn't really applicable here, but it's antiviral, great for mucous membranes, heals the gut, good for your skin. So it does so much.
So it tones down the immune system, but it's also healing up the gut lining. So it's working on a couple pathways just here even for this purpose.
And then more specific to the gut lining would be things like glutamine, MSM, as a
collagen,
as a precursor to making that connective tissue, right? Dr. Angela uses MSM a bit more than I do, so I'm always learning from her as well. And other nutrients to kind of help heal the gut lining again. The zinc carnosine.
The zinc carnosine is a really good one, definitely.
And then probiotics. You know, again, probiotics do so many things. We just did a video about bad breath, and probiotics can help with that. But it also helps with something like, you know, Graves, where it's an autoimmune issue. And, you know, everything in our body really is about balance, and it's not about eliminating something like we can't ever get rid of all the bad bacteria and only have all good bacteria, but everything's living in synergy. So probiotics are great for strengthening the immune system and crowding out any kind of yeast or bad or pathogenic bacteria that's affecting our gut health.
And they do actually talk to our immune system and calm things down. And so, I mean, again, wonderful multi-purpose. You also, a few weeks ago, had reminded me, like, you know, how we learn things and we forget things, that colostrum also has a wonderful role here in autoimmune.
So colostrum is that first really nutrient-dense, antibody-rich milk that comes in before the whole flow of breast milk. And same in animals, same in, you know, I mean, we're animals, but in humans as well. And so it's like amazing for the immune system. So colostrum definitely is an excellent one. And you can even use it topically. You can make a little paste with the colostrum and put it on your face. I've done it for acne.
Queen of skin. I love it. I learned so much here too.
But yeah, the colostrum is great. And then kind of going back to what we were saying before, that, you know, the Graves manifests as everything being sped up. And so you're, you know, breaking down muscle, your metabolism is higher and breaking things down. It's kind of like what happens when you have a fever. When you have a fever, our temperature goes up and everything in our body speeds up in order to filter more blood. So unfortunately in Graves, you're sort of in this heightened, constant state of everything being sped up. And so that's why you can have everything from anxiety
to muscle wasting.
To muscle wasting. So making sure, that you are meeting your body where it is in terms of its needs, because you're depleting the reserves like super quickly. So just straight up in terms of calories, making sure that you're getting enough calories so you're not wasting away and having muscle wasting.
And fat's an easy way of getting lots of calories
in. A lot of healthy fats. So avocado, actual healthy oils, grass-fed butter, grass-fed ghee, definitely cold-pressed organic oils, avocado
So high
oil.
quality, but lots of healthy fats. Nut butters, if you do okay with nuts, if they're not an allergen for you.
Very easy to get nutrient-dense calories up. And then enough protein as well.
Definitely, because muscle wasting is a serious issue with Graves, and so just making sure aminos and proteins and just overall calories are up. So kind of think about it as like your body in like a marathon training, just needing really a high amount of calories until this gets contained, and hydration for that matter too. Yeah.
So is there anything else that we're missing?
I think that's pretty thorough. Well, what I would say is back to the underlying cause, that any autoimmune condition is actually multifactorial most of the time. So often there's a genetic predisposition, not always, but often there is. But then things like stress or trauma happening, hormone shifts that are rapid, gut dysbiosis, food allergens. Stress is a very common one that breaks down GI lining and then kicks the whole thing off. So trying to address the various systems that may have started the whole process, if you can work with your integrative team to pinpoint that. Yeah.
It's always multifactorial.
We just want it to be so simple.
I know.
One day we're going to find a topic that's just super simple.
No, I doubt it. Thanks so much for stopping by and for watching this video. It is a little bit more of a serious topic, but for those of you who are suffering from Graves or who need a little bit of a starting point,
there's hope.
Definitely there's hope, and hopefully you found this information helpful. Share it with anyone you think might need it or enjoy it, and we will see you back here soon.
We'll see you back here, everyone. Thank you so much. Keep the questions coming, keep the comments coming. We learned so much from one another, so that's been wonderful, and we've been loving watching our community grow. Thank you.